therefore I'll be able to deliver his key message. But first is to thank His Excellency Governor Ongwae for taking us through truly the challenges and the goodies of implementing health in the devolved systems. I think you've raised very pertinent issues that basically would require continuous consultation between the national and the county government to ensure that resources are equitably distributed to ensure effective implementation of the devolved system. Secondly, you've also raised the issue of how well are the human resources for health are distributed in our respective counties. And I think this we should take it as a challenge, and especially our colleagues, the CECs and the chief officers. How well have you distributed your human resources for health? Where do you have much more needs in regards to the organization of your health systems? And basically, given that our thinking, our policy is to shift from curative to preventive, promotive, you really need to focus on ensuring that you have more of your workforce at the primary health care level to ensure that preventive and promotive services are taken care of. That way, you'll be able to have fewer of your complicated cases reaching at the tertiary level when this is well done. Of course, before I dwell into the speech of the Cabinet Secretary, let me just say that the matter that has brought us today, ladies and gentlemen, is very critical. The issues of human resource. And I take it as a very critical pillar, a very central pillar in a well-functioning health system. It's something that needs to be given much more thoughts and much more investment than it has ever happened even before the devolutions. Of course, there is need to have very powerful national policies, guidelines and strategies that will ensure that we have proper training, we have proper recruitment and placement of our health workforce who are very well motivated and who have who will be able to ensure that your systems are actually functioning. Of course, our constitution ensures or tells us that health is a right, it's not a choice, right? The need for us to ensure that even as we transition, as we move from the MDGs to the SDGs, we need to have a very strong army of human resources for health at all levels of care, but more importantly at the primary health care, so that we are able to build and sustain a resilient health systems at the county level. And I think this should be the bottom line, strong, resilient health systems. And I think human resources is very key. And if you will not be able to discuss about issues of human resources in your county on a daily basis, then you are doomed to fail. And therefore, ladies and gentlemen, it therefore gives me great pleasure to join you this morning for the celebration to mark the USAID-funded human resource for health capacity building project implemented by the IntraHealth International. Today, I'm happy to participate in this forum to honor the very contribution of human resource for health capacity building project in the management of human resources for health across the nation. And as you are aware, this project came into force during the devolution period, and I'm happy to report that it has established and strengthened human resource systems in counties. And through this project, the Standing Interagency Committee on Human Resources for Health, which is convened by the Public Service Commission and the Ministry of Health, has resolved many devolution challenges as outlined by today's presentation. And I want to take this moment to appreciate the good work of His Excellency the Governor James Ongwae and His Excellency Governor Jack Raguma. These are two counties, and as what the Director of Human Resource and Development, Njoroge, has said, these are two counties that we see as the yardstick of well-managed human resource issues. We've never had any issues of human resources in these two counties. In fact, if you were to give a scorecard, James Ongwae would give you a very good scorecard on human resource issues management. So, ladies and gentlemen, constitutions, of course, guarantees that all Kenyans have the right to the highest attainable standard of health. And the county has taken bold steps to address the rising burden of preventable diseases as outlined in the Kenya Health Policy's strategic objectives. The ministry is committed and remains committed to ensure that every Kenyan is a beneficiary of this right. As devolution has given us a unique opportunity to tailor interventions according to the specific needs of the different counties, thereby bringing health services closer to the people. There's no doubt that for us to achieve this constitutional requirement, we must have skilled and equitably distributed and well-managed health workforce. And I think this is very critical, even as a country, as we roll out the managed equipment services project, there is a need for us to have a very well-managed, skilled, specialized health workforce that will be needed in critical care, in radiology, and also in the dialysis services. And therefore, today's event gives us an opportunity to celebrate the gains made in addressing the challenges of human resources for health, to identify gaps and the future of health in addressing not just the global threats, but also the local public health threats, like what we have seen in the past, the cholera outbreak, and what we have also seen in the last 2 months, the outbreak of chikungunya, among other diseases. Ladies and gentlemen, I'm happy to affirm that the government is currently fulfilling the promise of better health for all Kenyans by consistently increasing funding to the health sector to support innovative approaches and strategic projects which are currently transforming the lives of Kenyans across the 47 counties. Of course, the government has invested, as you all know, 38 billion shillings in providing the digital diagnostic equipment in 2 hospitals in each county. Of course, you are aware of the free maternity services that are being offered in all public facilities at a cost of 4.5 million shillings annually. You are all aware this program is to be expanded to include the faith-based and the private for-profit facilities come January 2017. And this project is going to be called the Linda Mama Project. All Kenyans can now receive free services at primary health facilities due to the foregone user fee at a cost of 900 million shillings annually. Of course, investments have been made to reduce the burden of HIV, TB, and malaria to the tune of 25 billion shillings. Fifth, the NHIV benefits scheme has also been expanded. And I think this is where we have more emphasis. We've expanded the NHIV benefits to cover now the chronic illnesses such as cancer, diabetes, and hypertension. We've also established a central command unit for disease control in this country, which is one of its kind in the East Africa countries, to be able to coordinate the response to disease outbreaks, which is now currently coordinating disease threats across the 47 counties. For those who have not known that this emergency operation center, you need to visit it. It has a state-of-the-art equipment that can really monitor what is happening across the 47 counties. But of course, seventh is enhanced consumer protection and safety of patients through technology. And through this, we have now the mobile platforms of applications that we are able.
All right, so that is the health lobby group, IntraHealth, which is this morning releasing results of a survey done on Kenya's health workforce. Now, of course, the health sector, whose functions were devolved to the county governments, has faced turbulent times. The persistent strikes with the latest hitting Nairobi and Kakamega counties. All right, so that is that status report that is being given there today. But we also understand that the CS for Health is Cleopas Mailu is there, and he will be making his statement, and we will be crossing over back there to listen in. For now, though, we want to